On the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on Morning Line. Nick Barris back in the saddle today, coming to you live and direct. Thanks to Rebecca Schleicher for filling in for me the last few days. She did a great job, and it's great to have her on board with us when I step out. But don't worry, she's not replacing me, even though some of you might like that. I'm here to stay. Anyway, it's Wednesday, and we've got a good show on tap for you. One of our regular guests this morning, we're going to be talking about medical malpractice. Doctors, are you always pleased with the results you get from your doctor? And if you're not, do you think you may have a malpractice case? This is becoming a more and more popular segment of our Morning Line, schedule in terms of talking about this as more people deal with these issues. And here's your chance to get some free legal advice from one of the best malpractice attorneys in the state. That would be Clint Kelly.
Good morning.
Nice to have you on, sir. It's good to see you.
You talk like you're a bad weed, hard to kill.
That's me. That's exactly. I hope so. Anyway, I'm here to stay. But Rebecca did a great job filling in. Now, you also come on Nightside, right?
That's
Karen.
right, on the night show. It's usually Chuck Long, and then occasionally it's Ben or Carrie, depending on if it's a different night.
Yeah, she's great, isn't she?
Oh yeah, she's awesome.
Yeah. So and it's always talking to you. Every time you come on, I learn something. I imagine it's the same thing for them. And I think our viewers, it's your chance. It's things sometimes you don't think about. We all go to doctors. We all have questions about whether or not sometimes things were done correctly, and we don't know. It's kind of like when I go to a mechanic. I take the car and I drop it off, and I've got a mechanic I happen to trust now, but I don't know what's really going on under the hood. I know nothing about the car. Now, you'd think you know a little more about your body, but I defer almost always blindly to my doctors. Smart move?
Well, it's not a smart move. You do have to have
most people.
You have to have some trust in your professional, but there's an old saying, trust but verify, and you want to make sure that whatever's done, you keep an eye on it and make sure it's done right.
And that's the question, and then we'll get into the more specifics of malpractice. And of course, we're going to take your phone call, 737-7587. But how do you know that? I mean, I don't have a medical degree. I have experience having gone to doctors throughout my life. And are you just saying you Google, start researching? How do you do it?
Well, I'm first a big believer in second opinions. I think getting a second opinion is crucial if you're going to have any type of serious invasive surgery, or you have a disease or a problem that's going to be fairly complicated. Always make sure that you get yourself a second opinion.
Okay, so if you go to the doctor and he says, I recommend surgery for your back in this instance,
I would get a second opinion.
Just in case, go to another doctor just to make sure.
Sure.
Especially for something major like that, if they're going to cut on you.
Sometimes, Nick, the second opinion that's the physician who will do or take more time to explain what's going on with you than the first one.
Yeah.
Because that's really what you're paying for. And they can explain in layman's terms exactly what's happening and give you, I think, a better idea of whether you need to have the procedure and what the risks and benefits are.
And you always, a big advocate, ask questions of your doctor.
Always ask questions.
Would you, and I don't know if this would make a doctor uncomfortable, would it be bad to have a tape recorder when you're asking questions? Not like I'm trying to get him in trouble or anything, but so I can refer back, Doc, when I'm thinking about the procedure.
Yeah,
would that be weird?
Well, first of all, if you're going to do that, ask the doctor. I think there's something unseemly about it.
Yeah.
But if you need to hear the information again to make a judgment, then sure, I think there's
the doctor probably go along with that.
Probably would, if it helps the patient understand what's going on and help the patient make a good judgment.
All right. Well, okay, those are just some of the basics of how you handle a physician. Now, many of you may have had problems with one or other, hurt. Maybe a procedure didn't work as you planned it to go. How do you know whether or not you might have a malpractice case? I always like to throw that out. Every show you come on, we're going to do that.
It always requires two things, Nick.
Okay,
it's a major medical mistake and major medical damages or injuries. Those two have to be connected.
And a mistake has to be clarified perhaps by not living up to the standard of care?
That's exactly what it is. You have to prove that the doctor failed to live up to the standard of care that's required of him or the nurse or the hospital under the circumstances.
All right. How do you come about getting cases?
Well, sometimes clients call this show, and I will refer them to my nurse. I have a nurse consultant that works for our office, and she'll take information from them, and I'll make a judgment after I get that information of whether I think the case is meritorious. I get referrals all the time. One client will refer another client to me. Sometimes I get referrals from other lawyers, particularly lawyers who don't do this type of work. And need someone who does do this type of work to take on a client and decide whether or not the case is meritorious.
Now, when you say this type of work, I know lawyers have various specialties. Now, there may be some general practitioner lawyers that'll take on a malpractice case, but you're certified to do malpractice.
That's correct.
So if you would, specify the difference there and what the advantage is.
Well, that's something that the legal profession, the medical profession have in common. They have specializations. A plastic surgeon, a lot of your plastic surgeons are board certified, meaning they take an oral exam, a written exam. They have to have a certain amount of procedures and work done to qualify for board certification. By the same token, I'm board certified in medical malpractice litigation. I had to have a certain amount of jury trials, medical malpractice jury trials. I had to pass a written exam and also pass a verbal exam. And then I have to have a committee of my peers look over my work and experience and decide whether I qualify, which I did. There are very few board certified medical malpractice lawyers in Tennessee. You said that there are general practitioners that do take these cases. It's very rare nowadays, Nick, because of how specialized this field of litigation has become.
That's why you get referrals then sometimes. Right. So the bottom line on that then is you have the experience, you've seen it, and you don't handle any other cases but malpractice. Do you do divorces?
No, I do not do divorces.
Okay, you don't do any criminal law?
I do very, very little criminal law, and that's only because I have some experience in representing some marijuana cases and DUI cases from back in my youth, and I like doing that, but that's a tiny minority. The rest of it's malpractice.
I'm just curious too, in some of the very extreme cases of malpractice, could they sometimes, separate from what you're dealing with, become criminal? Well, I would imagine a doctor who has 5 martinis before trying to cut me open to remove my spleen is going to face a criminal charge if I end up suffering damage for that.
Yeah, there's one case that I've had in the past that I know for a fact the doctor would have been charged with a crime had the facts been known to the district attorney, because he was clearly impaired when he performed surgery on this woman and blinded her.
Okay. All right. So in some cases, that's the way it is.
But that's the only exception. I mean, the rest of them are simply civil cases. They're cases in which, a standard of care has been broken or violated, duty owed to the patient, and there's compensation owed. We don't put doctors and hospitals or patients in jail, nurses in jail, unless there's alcohol involved.
Exactly. Something extreme like that.
Right.
All right. We're going to take phone calls, 737-7587. I just wanted to give folks a sense, one, of how you hire an attorney like him. He'll take on your case if he feels that you have one, and that it is one where there can be some recovery that makes it worth your while. You have to make a living, of course, right? So you sit down with them, you evaluate it, and you only get paid if you win.
That's correct. The client pays nothing unless I get a recovery for the client. That's real important for people to know. The consultation is always free, and it never hurts to call. Even if you think your case may be borderline, always call, get an opinion. If you've got a case, that's great. If you don't, you've lost nothing but a little bit of time to talk to my nurse.
Exactly, and we'll talk more about why you need to do it as soon as you suspect something. Before we go to break, we've got Joe and Arthur and others waiting, and the lines are open. Just throw out among the types of cases that you've handled, what are the most common, perhaps, that some of our viewers will relate to, or that maybe some of our viewers are thinking about they're dealing with themselves? What, back issues?
Back issues, and Nick, we're going to talk about this after the break. I'm getting a lot more blood clot cases.
Blood clot cases?
Yeah, and we'll dig into this deeper after the break, but it is becoming now a major, major health epidemic. People who go to the hospital, have procedures done, develop a blood clot, and either have a pulmonary embolism, which is potentially fatal, or they develop a blood clot in their legs and it causes swelling and damage in the legs. And it's getting to be a major issue for hospitals to deal with, and I'm getting a bunch of calls from patients who've had that.
Really? All right, that's interesting. All right, we'll take a break on that note when we come back. If you're on hold, stay there. We'll get to your phone calls. Lines open if you have a question or comment about malpractice and whether or not you feel you've been harmed, or maybe you have a case. Clint's here to answer your questions right after this. Stay with us.